Botox. Is it supposed to look like this? First time doing Botox. I asked for forehead only. She told me I should do glabella too, but I didn't want everything done my first time, and the forehead lines are the ones I feel more conscious about. She said, if you don't do the glabella, it will look weird, but okay. And now, after 3.5 days, it looks like this.
Thank you for your question. You submitted a question with one photo, and you describe in your question that you've done Botox for the first time, and that in discussion with your physician, that your physician had recommended, in addition to doing the forehead, which you want to do alone, the physician recommended you do the glabella as well. And so you decide to just have the forehead done, and you submitted a photo 3 days after the procedure and asking if it looks normal. Well, I can give you some guidance as to how to continue with doing Botox and understanding the process a little bit. And it's likely your doctor discussed this with you, but this is new for you, so I think it's important to understand some basic ideas. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. In fact, my specialty of oculofacial plastic surgery were amongst the first physicians using Botox. So I've been using Botox for patients since 1993. So to begin with, it is very important to wrap your mind around this concept of how Botox works. Very often people believe that Botox is a filler, which it is not. It may behave like a filler because of the net effect. But what Botox does for the areas of your concern is basically improves the appearance of wrinkles. There are two types of wrinkles: dynamic wrinkles and static wrinkles. Dynamic wrinkles are wrinkles that occur when you activate muscles. Static wrinkles are wrinkles that occur regardless of muscle activity, that are present at rest. What Botox does is it relaxes muscles. And so when you talk about the forehead versus the glabella, you're actually looking at two different sets of muscles. The forehead muscle that you want to smooth is the muscle that lifts the eyebrow. It's a muscle called the frontalis muscle. In the photo you submitted, it appears that you have some movement of the frontalis muscle in the lower part, and the upper part looks relatively smooth. It essentially is reasonable to understand that this is likely the area that your doctor injected and limited the area as your doctor got closer to the eyebrow. And there's a basis for that. The glabella, which is the area where the frown lines is often done in combination to help rejuvenate the forehead, let's say an aesthetic unit, an area where you want to eliminate or improve the horizontal lines as well as the vertical lines, the number 11 lines. So certainly your doctor expressed to you their concern that it may look unnatural or not in harmony. So understanding that it is very important that you appreciate what is the timeline for the effect of Botox. Yes, you can start seeing changes as early as 24 to 48 hours, but in my practice I have people come back in 2 weeks. Clinical studies have shown that the peak of effect can be around 2 weeks. So that is when I determine the effectiveness of the Botox and whether there's an indication for enhancement. Another important element of this is the importance of what is causing the horizontal lines to form. Very often people raise their eyebrows very aggressively because they have drooping brows and because they have extra skin over their eyes, called dermatochalasis. So unconsciously people will reflexively raise their eyebrows, and in raising their eyebrows they are forming horizontal lines. So the practitioner has a challenge very often, and since we don't see the rest of your face, It's just something that I'm just giving you some information about. Essentially, you don't want to do Botox so aggressively that the forehead completely relaxes and the brows drop, nor do you want necessarily to have the completely smooth forehead, because that in itself can sometimes not fit the rest of the face, especially when you're looking at an area with isolation. So allow yourself some time to evaluate the results. Visit your doctor or contact your doctor in about 2 weeks for a reevaluation from the time of your injection. Learn more about this, and I would stress strongly that find a doctor that you feel comfortable with and that you feel can work with you as you continue your journey into doing this on a more consistent basis. So I hope that was helpful. I wish you the best of luck, and thank you for your question.